In Kano, the people pride themselves as pace setters who will trump whatever challenge is brought before them. And as Tumbingiwa, this ancient city tells us that it is a melting pot that is accommodating of all. It leaves little to imagination, therefore, when the African Center of Excellence for Population Health and Policy, Acephap, found a base at the city's foremost institution of learning, Bayero University, and from there opened a new vista in health population research and training that is designed to influence health policies across the African continent.
Acephap started as a center for advanced medical research and training. Bayero University, Kano established this center way back in 2015-2016.
Led by Professor Hadiza Galadanchi, the center at inception was known as the Center for Advanced Medical Research and Training of the Bayero University. It was the initiative of the university and it operated independently until they responded to a call for proposals by the World Bank Group for Centers of Excellence. The proposal by the Center of Advanced Medical Research and Training of the Bayero University scaled through as one of the few selected out of the total 155 entries that were submitted to the World Bank Group.
A call came out from World Bank to write proposals for African Center of Excellence in any field. At that time, I was given the center to direct the center as the director of Center for Advanced Medical Research and Training. And at the same time, I was supervising other health-related African Centers of Excellence in other parts of the country. I now realize that, we have expertise within the Center for Advanced Medical Research and Training, as well as colleagues in Aminu Kano Teaching Hospital and Bayero University, Kano. And I felt we could form a team that could write a very good proposal and hopefully be funded by World Bank. And that was how I got a team and we started writing the proposal for African Center of Excellence for Population Health and Policy. And after writing the proposal, we submitted to World Bank. And out of about 155 proposals, we were chosen as one of those that won the World Bank grant.
The African Center of Excellence for Population Health and Policy is aimed at promoting population health outcomes through training and research for evidence-based policy development. It is a project supported by the World Bank Group.
We have like 7 departments that make up Acephap project. So we have a gynecologist from Department of Obs and Gynae, we have pediatricians from Department of Pediatrics, we have the biochemist from Biochemistry Department, we have the nursing department, we also have internal medicine department, and then we have community medicine department. Now in each of these departments, we have faculty that are teachers that teach our postgraduate students. Now we give them support in terms of how they can develop better in terms of their academia as well as in terms of research. So we will support any one of them that is going for training for anything that is related to the particular topic or course that they're teaching our students. They can go for training anywhere in this world. The World Bank will support that. We also support them to do internship. Also learn, they can do internship in industries and learn about how you can translate a finding in research into a product, all right? And then we'll also support them to publish. When they have papers to publish, we will pay the money. Nowadays, if you want to publish in high impact journal, you pay in dollars. So now Acephap is ready to support that. And then we have, we can support them in terms of getting grants getting research grants so that they can do further research, and then they can now address issues that are of concern in the community. And then, of course, access to e-learning facilities. We intend to have databases that they can come in, so we subscribe for these databases and they can now have access in terms of literature search. We also will support them for conferences. So if they have a student and they have done a project together and they want to present in any conference or any workshop or any seminar, the center will support both the faculty and the student to go and make that presentation. So these are just some of the support that we give our faculty.
2 years since its commencement, it is already breaking new grounds and making global impact with research findings that have reinvented decade-long practices and ushered the world into a new era with findings that put to rest decade-long practices in Labor Care Guide.
We've achieved a lot as regards researches that we've conducted. I'll start with the LCG project. It was about, LCG means Labor Care Guide. So we reviewed the pathograph, which has been in use for several decades, but had a lot of things that were not captured or other things that needed to be added. So our center was the one that conducted that research to see how the new pathograph, which is called the Labor Care Guide, we were able to test its use amongst healthcare workers here, and that helped the review a lot. And right now, WHO is going to bring out the new pathograph that people will be used based on the findings of the research that we did. So that's completed.
Kano's history as an intellectual center goes back to centuries. Yet, that history resonates with the modern quest by Kano through the Center of Excellence in Population Health and Policy that has taken roots at Bayero University, spreading its tentacles and attracting some of the best students from across Africa, training skilled human resource to address health concerns of the Sustainable Development Goals 3, which aspires to ensure health and well-being for all and end epidemics like AIDS and malaria that have plagued Africa.
The team decided that the mission should be that we should train a human resource for health with a focus of conducting research in population health issues so that we can achieve the health sustainable development goals, and mainly by conducting research and then influencing policy decisions in Africa. So that's our mission. And you see, we chose sustainable development goals, and we chose specifically goal number 3, because as far as we're concerned, one of the major challenges in terms of development in Africa is health. And all the health-related SDGs are SDG 3 in terms of maternal health, in terms of child health, in terms of non-communicable diseases, in terms of HIV, in terms of malaria, in terms of even mental health. These are the key issues in SDG 3, and that is what we are targeting. So we're producing human resources that are going to be doing research in this field with the hope that they will influence policy, and we're going to have an improvement in our various African countries.
Africa's long struggle with maternal and child health and infectious diseases is well documented. According to the World Health Organization, Africa accounted for 95% of the world's malaria cases and 96% of malaria deaths in the year 2020. It is a grim statistics that brings us face to face with the enormity of the challenge, but also highlights the importance of the Acephap program.
We're doing a research in emotive, which is trying to see if we can develop a bundle to manage postpartum hemorrhage. One of the commonest causes of death is postpartum hemorrhage. Now we are developing a bundle, and we're one of the countries that are part of the global research. And the center here is representing Nigeria. Now, if at the end of the day we have a result of our project, and it shows that, you know, this use of this bundle can actually save life, and then it influences the guidelines that WHO is going to write on PPH care, and they now adopt the bundle approach in managing postpartum care. Forever, we're going to be proud of ourselves that we have impacted in the management of not only one labor case in Aminu Kano Teaching Hospital, but a labor case anywhere in this world.
In the face of this grim situation, this program presents a glimmer of hope, a ray of light that is shining through as Bayero University leads a homegrown offensive to fight back disease through manpower development and training.
We have research groups in our center that are doing wonderful researches. We have the sickle cell group that have now developed, the SPIN trial, that have tried hydroxyurea in Kano, here in Aminu Kano Teaching Hospital and Murtala Muhammad Specialist Hospital. Now every single sickle cell child is placed on hydroxyurea. It has changed the management of sickle cell. So you can see the impact is already being felt.
And one important thing about the center is what we call policy implementation. So we are tired of conducting researches that the findings will just be there. We are looking at these findings, how can it be implemented such that it doesn't stop in that particular place where we have done our research. We want it to be something, for example, we're happy about the LCG. So it's going to affect the whole of the country and even worldwide, the pathograph. So other researches, for example, we are doing one on postpartum hemorrhage now, the emotive. So when we finish, we would like for the results of that research, we will ensure that it becomes a policy that people are implementing and it doesn't just stop with our research. So that is one major thing that the center is all about.
We're trying now to try a drug to manage anemia in pregnancy. Before we use oral drugs to manage anemia in pregnancy. Now we're trying an injectable drug. If this injectable drug works, we can change the policy of managing anemia in pregnancy. So there's a lot of impact that we're feeling, or we know we're going to get at the end of the day from the various researches that we're doing.
These kinds of support from the World Bank Group is aimed at promoting specialization to address identified challenges and strengthen the capacities of the recipient universities to deliver quality and applied research.
Oui, je dois dire qu'il est très important que beaucoup puissent participer à ce programme-là, parce que cela va beaucoup avantager nos différents pays. Et cela va nous permettre, bien sûr, de venir au plus près de nos populations, en ce qui concerne, bien sûr, la formulation, bien sûr, des politiques de santé.
If you look at the curriculum that we are using in each and every program, they solve most of the needs of the present, and also some research support that we are given by the center. Apart from that, stipends are given each and every end of the month to cater for the need of the students.
Vraiment, non seulement les cours qui sont dispensés en anglais, on a vraiment une grande opportunité ici parce qu'on apprend la langue anglaise. Et vraiment, ce master va nous permettre de travailler un peu partout en Afrique. Donc, j'encourage les gens qui ont appris dans l'Afrique de ce programme de venir vraiment massivement pour en profiter.
As an African Center of Excellence, the programs are open to candidates from across the continent. Already, students from other sub-Saharan African countries like Sierra Leone, Cameroon, and others are already enrolled in some of the programs.
I'm coming from Cameroon. and I really desired to do mental health. But when I look around, I didn't really see a place or a school that does that.
For instance, I'm from Ghana. I don't have such course in my country. Even though my country has a very big psychiatry hospital and mental health structure, we don't have MSc mental health, public mental health. So I will be one of the beneficiaries from my country.
Definitely the training we are receiving in Acephap is giving us that ground on how to go about the policy making and policy relationship with the healthcare providers, the consumers of the healthcare system, as well as the general public.
I've had classmates from Ghana, from Sierra Leone. I feel I can make policies, I can impact in different parts of the world.
The internationalization of the program is in tandem with the goal of the World Bank Group for African universities to become cosmopolitan, both in students, population, and faculty.
Part of the goals of World Bank is to make sure that African universities have become internationalized. In the 70s, in the 80s, Nigerian universities, when you come to Bayero University, when you come to Ahmadu Bello University, and many other universities in Nigeria, there would be a mix of international students, students from Africa, sometimes from Asia and other parts of the world, as well as in the faculty, the teachers that are teaching in these universities are also drawn from different parts of the world. However, through the 90s and the 2000s, a lot of changes have taken place in such a way that our universities are a little bit less, can I say, cosmopolitan, if I may use that. And because of that, the plan of the World Bank is to help us achieve internationalization of our universities. So we give preferences, we also give assurances, and give slots to regional students, as well as gender empowerment. So we want to have at least as much as maybe 30% of our students be coming from regions, West Africa region, Central Africa, East Africa, different parts of the African continent are coming. And then of course, we want to make sure that we also attract female students to address the issue of gender and parity in gender and things like that. So yes, we do give specific concerns in terms of having more regional students, as well as having more female students. And in our plan in the future, we also want to have a situation whereby the faculty will also reflect internationalization of the university, so they will have faculty that are from different parts of Africa, different parts of the world, so that there will be interactions and the standardization of our degrees will be maintained.
This tissue typing laboratory at the Kano Teaching Hospital was established through a collaboration with the hospital, the NNPC and Acephap. The facility is a major milestone. It is used for renal transplant. It is also a testament to the immediacy of the impact that this project is having in the healthcare delivery system. Before now, tissue typing samples that are done here were tested in labs in the United Kingdom, Egypt, and Sudan. Further collaborations between the Kano Teaching Hospital and Acephap has led to the establishment of state-of-the-art facilities that are used for molecular tests, hematology tests, and DNA extraction for tissue typing. For most of the students here, it has been a fantastic experience on all fronts. Mohammed Kai is a Sierra Leonean student in one of the programs. Together with other students in the programs across the center here, he say the program has been a blessing.
My name is Mohammed Kai from Sierra Leone, and honestly speaking, I feel blessed and I feel opportune being here, because from the onset of this entire program, it has been a blessing and everything has been well organized.
Personally, I've always been someone that's been very passionate about understanding health of different places, general public. So this was a one-time opportunity for me, and I must say it has been amazing so far. Starting with the cross-country, meeting people from different countries, different nationalities, understanding their health, seeing from their lens, from where they are coming from. It has helped me to see health generally from different perspectives, seeing the similarities, the diversities, and how things can generally improve. And most importantly, understanding the policies that binds us together, basically.
The experience has been really great. And it's really been an opportunity to come do what I've come to study here. Acephap programs have really been great, and I came for mental health, and it's really been wonderful. So I can say the experiences have been great. I really can, they are numerous. I cannot really list all of them.
Actually, I have a great experience, ranging from the varieties of lectures, relationship with other students from other countries, that is different African countries. We were relating together and we keep relationship. And we have some beautiful experience, like I came to read public health, nursing, and policy. So there are a lot of experience that I'm gathering, which I believe will help in my future undertakings.
It's a grouping of most countries from other parts of Africa, and we are learning from each other. Actually, I've met people from Sierra Leone, from Cameroon, and I'm learning new things from them in terms of their health structure, because we usually discuss in class.
The center is also working to make its programs better. It has conceptualized an infrastructure development plan which will see the construction of a hostel to house mainly international students for the programs and upgrade the classrooms that participating faculties will be using to provide digital learning, as well as equipping the labs for cutting-edge research.
As part of the infrastructure rollout, to build a student hostel that would house largely our foreign students, which is going to be situated here within the structure of Kano Teaching Hospital Complex. We equally intend to equip or bring to state of art the classrooms that the participating faculties, largely 7 of them there, to bring them to a state of the art. And with regards to the lab, we have 2 forms of lab. We have wet labs and dry labs. So we intend to equip our wet labs to be able to do some basic investigations, and our research labs will have the capacity to do some cutting-edge research also. With regards to the dry lab, we intend to have a data lab, an e-library, where both students and faculty will be able to access and utilize them to have efficient and optimal training experience.
Guided by a robust research plan and direction. Within its short years of operation, the African Center of Excellence for Population Health and Policy has achieved some great feats in research and received global acclaim for its accomplishments in reinventing the Labor Care Guide project, which revealed the pantograph that has been in use for many decades.
We did a research on Labor Care Guide. Labor Care Guide is a new guide developed by WHO. We were one of the sites that tried this Labor Care Guide on women that are in labor. Based on our trial, now WHO is saying globally, that we should start using Labor Care Guide.
The collaboration of the World Bank Group will last for 5 years, after which they will end their support. But the center says it has made plans for life after World Bank support. This is coming through a robust sustainability plan.
Sustainability is very key. And in fact, right from when we're developing the proposal, we had to think about sustainability. World Bank is supporting us for 5 years, but that does not mean after 5 years we have to close down the center. So right from inception, sustainability is key. Now there are various ways that we have thought of how we're going to be able to get funding to be able to continue what we're doing. Number one is the postgraduate studies we're doing. Already in the 2 years that we've started, we have developed 5 postgraduate programs. These are programs that we didn't have before, and now we have them in collaboration with all the 7 departments. Now these PG programs are going to continue because we are all staff of the university. World Bank is not paying us to teach the students. So we're going to continue to provide these programs to our students, and therefore we're going to get money for tuition. Now right now the tuition fees goes directly to the university, but we're hoping when we don't have any more funding from World Bank, we'll sit down with the university and see how we can share part of the tuition fee so that the center can continue.
We have in plan development of new PhD courses in some of those 5 programs that we are currently running master's program in. And then of course there have been some proposals that we may have additional master's programs in some other departments in Bayero University that are associated with the Africa Center of Excellence in Population Health and Policy.
We've written a lot of grants. The Acephap, African Center of Excellence for Population Health and Policy, has given us a platform to apply for grants, apart from the World Bank grants. Right now we have a lot of grants that we have been able to get, and we're now having funding to do research. Now we're going to continue to look for grants. Even after the World Bank money has gone, after 5 years, we're going to continue to look for grants. And this grant will give us opportunity to do more in terms of research. And therefore, we're going to continue to be able to fund activities of the center. The third thing is that we're going to build an international student hostel. That's one of the activities we're going to have. In fact, the major construction that we're going to have. We're hoping that International Student Center is going to be bringing funds to us, because apart from having regional students in the hostel, we will open it up for anybody that wants to use our facility. So for example, Kano Teaching Hospital, if you have visiting professors that want to come and teach or provide services, or you have a workshop, or you have a conference, we open our international hostel to people that want to utilize it, and we'll be able to get funds there. Inside the hostel, we're going to be having gym. We intend to have a restaurant. So these places will all be bringing money to us, and therefore the center will continue. Other things is short courses. So far we have conducted quite a number of short courses. I think over 5 or 6 short courses. And these short courses, you charge participants. If now we're not charging people, which actually for some of our courses we charge, for some we don't charge, now we'll be charging students or faculty or any trainee to come and have training with us. That will also generate money that we can use. We have a conference hall, and we intend to give this conference hall to anybody that wants to use it. Any group, any research group, any academic group that want to do conferences or seminars or workshop will give the conference room, and we're going to charge for that conference room. We're also going to establish research labs, and our research lab will be open to researchers. So if you want to come and use our facilities in the research lab, we'll also charge you. So these are all the ways that we think we can continue to get funding, and therefore once we have funds, we hope that the center will continue to provide the services that it's already providing.
Significantly, the center is also taking advantage of the interplay of new frontiers in healthcare delivery, using the Triple Helix plan to bring government, research institutes, and the private sector to solve the complex entrepreneurship equation.
We realize that, we shouldn't be, in our towers in the academia and not really addressing issues that concern the community. At the same time, there must be a collaboration between the academia and the industry.
If there's anything Acephap has done since we started, a lot of collaboration. Collaboration nationally, regionally with other African countries, and then internationally.
So right from the beginning, we had the issue of triple helix as one of our approaches in achieving our goals. Mainly, we're working with industries as well as the community, first of all, to identify what are the issues. One of our major activities is actually entrepreneurship and innovation. So World Bank is actually supporting us. We intend to have entrepreneurship lectures and training for our students as well as our faculty. We intend to bring interested entrepreneurs to actually look at the major problems in terms of health in our environment and develop products. And these products, we're hoping that we can actually patent these products at the end of the day. I'll give you an example now. For example, having an app, an application that can actually support our antenatal care, that will improve probably the use of antiretrovirals for our HIV patients. These are all options that we can give our very skillful students and faculty. Develop an app, and once this app is developed, we can now forward it to the industry so that the industry can take it up. Or maybe you find a rapid test for any of our major problems, and you can now take it to the industry. Think about, nutrition, the malnutrition. You find maybe a very good combination of nutrients that we can give to our malnourished babies, and then we can take up to our food industry that can now package it, that can be now sold for the community. So we're really looking at improving the entrepreneurship skills of our students and our faculty, and then being very innovative. We're thinking of having innovation hubs, I'm collaborating with other innovation hubs around us so that we can really utilize the skills of our postgraduate students as well as our faculty and move the agenda of development as far as health is concerned.
No less, the program has challenged women to break new ground, excel in this endeavor, which hitherto is seen as an exclusive preserve of men.
I think this is a great opportunity, and I'm happy to say that in our leadership, you must have noticed that the center leader is a female, and one of the deputy center leader is also a female. So actually, World Bank encourages female to go into research arena, and that is why they encourage both leadership and as well as faculty as well as students to involve the female. So I'm really pleased because more than a third, in fact, getting to almost 50% of our students are actually female. I'm sure you must have seen, the students that are moving around in the center. Those doing maternal and child health, those doing global health, nursing and policy, nutrition. So a lot of them are female. So really, it's high time that female get into the arena of research. We've already given our contribution to academia because there are a lot of teachers that are female. But then we need to also go into research. Research is time consuming. Research needs a lot of skills and so on, skills of writing, skills of conducting meetings, skills of writing reports, skills of doing whatever you intend to do. So you learn a lot of things when you get into research. So I'm really encouraging, our female colleagues to join the research team, and especially here that we have Acephap to join Acephap. There's a lot of advantage, to joining the team. Now, we've done a lot in terms of clinical care, in terms of teaching residents and teaching students. But when you come to do research, you're going beyond to development of not 1 or 2 or 3 people. You're going beyond that. either nationally, regionally, or even globally.